Good morning, everyone. It's great to be here with you, and we will start our comments with Dr. Tam.
Good afternoon, bon l'après-midi à tous. Today I'll say a few words on the importance of contact tracing for maintaining epidemic control. But first, an update on the latest numbers for COVID-19 in Canada. There have been 102,242 cases, including 8,484 deaths. 64% of people have now recovered. Labs across Canada have tested over 2,518,650 people for COVID-19 to date. Over the past week, an average of 38,000 people were tested daily, with 1% testing positive. These numbers change quickly and are updated daily in the evenings on canada.ca/coronavirus. Achieving and maintaining low levels of COVID-19 is very important for minimizing illness and deaths, but it is also necessary to allow public health actions to bring the epidemic under control. If we think about cases and clusters like small fires, and public health authorities as the firefighters, then contact tracing and quarantine is like the water needed to extinguish the blaze. The more fires there are to put out, the greater the risk that public health resources will be overwhelmed trying to get to all the fires before the wind shifts and starts an uncontrollable blaze. When epidemic growth is increasing exponentially, as it did at the beginning of the COVID-19 epidemic in Canada, there were too many little fires that quickly merged into a big blaze. This is why closure of social and economic spaces was required, much like a countrywide fire ban, to bring the epidemic under control and not overwhelm the health system. Thanks to the collective efforts of all Canadians in what must be our biggest bucket brigade to date, the big fire is out, and local public health firefighters across the country can now do what they do best: case investigation and contact tracing to control the smaller fires. COVID-19 case investigation involves local public health experts and identifying cases through laboratory testing and conducting exposure investigations to understand how people become infected and who they may have passed the infection to. Contact tracing comes next and involves tracking down every person who may have been exposed to the case, either directly through close contact or indirectly in a shared space like a home or a workplace. The work doesn't stop there. People identified as having COVID-19 need to be provided with education and support on how to self-isolate and not expose others. Similarly, contacts which may be few or many need to be provided with information and support to quarantine and monitor for symptoms. Public health follow-ups need to continue for weeks until people and their contacts no longer pose a risk for spread to others. The success of case finding and contact tracing is in the speed and completeness with which it is done. The less cases and the fewer contacts per case, the faster and more completely new fires can be extinguished. That's where Canadians come in. By keeping up physical distancing and good hygienic practices, and avoiding high-risk exposure settings like closed spaces, crowded places, and close contact situations, we can stop new fires from starting as we reopen. Limiting the number of contacts that each have is also important, as it means less fuel for any fires that do start. This will allow public health to rapidly complete contact tracing and keep COVID-19 under control. Canada needs all the volunteer COVID-19 firefighters we can get to help smother the embers by keeping public health practices up and your numbers of contacts down. Thank you.
Thank you, Dr. Tam. Dr. New?
Merci. Bonjour. Aujourd'hui, je vous parlerai un peu de l'importance de la recherche de contacts afin de garder l'épidémie sous contrôle. Mais d'abord, voici les derniers chiffres sur la COVID-19 au Canada. Il y a eu 102 242 cas confirmés, dont 8 484 décès et 64% des personnes infectées sont maintenant rétablies. Jusqu'à ce jour, les laboratoires de tout le Canada ont analysé les tests de dépistage de la COVID-19 de plus de 2 518 650 personnes. Au cours de la dernière semaine, En moyenne, 38 000 personnes ont passé un test de dépistage chaque jour, dont un peu plus de 1% ont reçu un résultat positif. Ces chiffres évoluent rapidement et sont mis à jour quotidiennement en soirée sur le site canada.ca/le-coronavirus. La réduction au minimum et le maintien des niveaux d'activité de COVID-19 permettent de minimiser les cas de maladie et les décès, mais il est également nécessaire de respecter les mesures de santé publique pour maîtriser l'épidémie. Si nous comparons les cas et les groupes de cas à des petits incendies et les autorités de santé publique à des pompiers, alors la recherche de contacts et la quarantaine serait l'eau nécessaire pour éteindre le feu. Plus il y a d'éclosions, plus le risque est grand que les ressources de santé publique soient débordées en essayant d'arrêter toutes les éclosions avant qu'elles ne se propagent et ne se transforment en une épidémie non maîtrisable. Lorsque la croissance de l'épidémie se fait de façon exponentielle, comme ce fut le cas au début de l'épidémie de COVID-19 au Canada, trop de petites éclosions sont devenues rapidement une redoutable épidémie. C'est pourquoi la fermeture des espaces sociaux et économiques a été nécessaire, un peu comme l'interdiction de faire des feux à l'échelle nationale, pour maîtriser l'épidémie et ne pas surcharger le système de santé. Grâce aux efforts collectifs de tous les Canadiens, dans ce qui est sans doute notre plus grande chaîne de solidarité à ce jour, la plus grosse épidémie est éteinte et les autorités de santé publique locales de tous les pays peuvent maintenant se concentrer sur ceux qui font le mieux. Enquêter sur les cas et rechercher les contacts pour maîtriser les petites éclosions. L'enquête sur les cas de COVID-19 nécessite que des experts locaux de la santé publique détectent les cas par les tests de laboratoire et mènent des enquêtes sur l'exposition au virus afin de comprendre comment les personnes ont été infectées et à qui elles peuvent avoir transmis l'infection. La recherche de contacts vient ensuite et consiste à retrouver chaque personne susceptible d'avoir été exposée à la personne infectée, soit directement par contact étroit ou indirectement dans un espace commun comme un domicile ou un lieu de travail. Mais le travail ne s'arrête pas là. Les personnes infectées doivent recevoir des renseignements et des soutiens sur la manière de s'isoler et de ne pas exposer les autres à la maladie. De même, les contacts, qui peuvent être peu ou nombreux, doivent recevoir des renseignements et des soutiens pour se mettre en quarantaine et surveiller l'apparition des symptômes. Et le suivi de la santé publique doit se poursuivre pendant des semaines jusqu'à ce que les personnes infectées et les contacts ne présentent plus de risque de contagion pour d'autres personnes. Le succès de la recherche de cas et des contacts réside dans la rapidité et l'exhaustivité avec lesquelles elle est effectuée. Moins il y a de cas et de contacts par cas, plus il est facilement d'endiguer rapidement et complètement de nouvelles éclosions. C'est là que le rôle des Canadiens prend tout son sens. En maintenant une distance physique et des bonnes pratiques d'hygiène et en évitant les lieux d'exposition à haut risque comme les espaces clos, les lieux bondés, les situations de contact étroits, nous pouvons empêcher de nouvelles éclosions de se déclarer lors des réouvertures d'établissements. Il est également important de limiter le nombre de personnes avec qui nous avons des contacts, ce qui permet de limiter les éclosions. Ainsi, la santé publique pourra achever rapidement la recherche des contacts et garder l'épidémie de COVID-19 sous contrôle. Le Canada a besoin de tous les volontaires pour lutter contre la COVID-19. Aidez-nous à endiguer les éclosions en maintenant les pratiques de santé publique à la hausse et votre nombre de contacts à la baisse. La santé publique vous remercie. Merci.
Merci, Dr. New. On tourne maintenant à la ministre Hajdu.
We'll give the floor to Minister Hajdu.
Bon après-midi. Je suis ici aujourd'hui pour informer de bonnes nouvelles. Au cours des derniers mois, vous avez vu notre gouvernement investir massivement.
Regrets, but unfortunately, the quality of sound is not good enough for interpretation.
Grâce à un processus d'examen, par le pair rigoureux mais accéléré, les chercheurs canadiens ont pu se mettre au travail rapidement. En mars, nous avons lancé le financement de 100 projets de recherche actuellement en cours de l'université et les hôpitaux de pays. et ces projets montrent déjà des résultats prometteurs.
The interpreter
For
regrets
example,
again that the
researchers at
sound
the
is not good
University
enough.
of Alberta have shown that the drug remdesivir is highly effective in stopping the replication mechanism of the coronavirus that it causes COVID-19. This evidence supports the promise of clinical trials on this drug in patients with COVID-19. Also, researchers at the University of Saskatchewan and Vito Intervac have shown positive results from the preclinical testing of their COVID-19 vaccine candidate, setting the stage for a clinical trial of this vaccine in humans this fall. Today, we are announcing funding for 139 new and ongoing research projects. These projects will be supported with funding of $109 million from the Government of Canada through the Canadian Institute of Health Research and the International Development Research Centre, and from the provincial health research funding agencies in BC, Alberta, Saskatchewan, Manitoba, and Nova Scotia. Canadians can be proud that the scientific community has responded so rapidly. While the process for most funding competitions take many months, in this case, it was done in a matter of weeks, and there were nearly 1,500 applications. I want to thank and congratulate the researchers who will be participating in domestic and international clinical trials, scaling up promising existing projects that will increase our understanding of the efficacy of vaccines, therapeutics, clinical practices, and public health approaches to COVID-19. Their work will help accelerate the availability of high-quality and real-time evidence that can support Canada's rapid response to the global pandemic in order to better prevent, detect, treat, and manage COVID-19. For example, researchers at the Canadian Blood Services will study the antibodies of people who have recovered from COVID-19 to determine and better understand the level of immunity they provide against reinfection. At the University of Manitoba, Dr. Ryan Zaruchansky and his team will determine the effectiveness of anticoagulants in treating complications of COVID-19. And at the University of Alberta, David Marchand and his team will test the ability of an antiviral nasal spray to prevent infection in healthcare workers and others who are at higher risk of exposure to the COVID-19 virus. I know we've talked about this before, but it's very important to say it again. The work of these researchers is immensely important to our country and indeed to the world because the evidence they're gathering will inform clinical and public health responses, decision-making, and planning here in our country and all around the world. Finally, I want to thank the provincial partners for their contribution to this investment. We know that collaboration is what's getting us through this pandemic in our country, and we know that we can respond more efficiently to the global health emergency when we work together. Thank you very much.
Thank you, Minister Hajdu. Minister Qualtrough?
Hello, can you hear me?
Yes, we can.
Excellent, sorry. So good morning, everyone. We know that young people are facing a serious set of challenges during this pandemic, be it interrupted studies, reduced work opportunities, or disruptions to their internships and co-op plans. That's why in April, we announced a $9 billion investment in students that included temporary income support through the Canada Emergency Student Benefit to help students who might have seen their summer job prospects disappear due to the pandemic. We also announced increases to Canada Student Grants for all eligible full-time and part-time students, broader eligibility for student financial assistance by removing expected students and spouses' contribution in 2020-2021, enhancements to the Canada Student Loans Program by raising the maximum weekly amount that can be provided to a student, as well as a 6-month interest-free moratorium on Canada student loan payments. Toutefois, nous savons que nous devons en faire plus pour venir en aide à nos jeunes. Ils sont essentiels pour aider à relancer notre économie et à le renforcer pour l'avenir. Aujourd'hui, le Premier ministre a annoncé une série de nouveaux investissements destinés à aider davantage les jeunes Canadiens à trouver des emplois rémunérés et à obtenir les compétences dont ils ont besoin pour lancer leur carrière. We are further bolstering our investment in the Youth Employment and Skills Strategy by $34 million to help create more than 3,500 new job placements and internships for young people in high-demand sectors and sectors in recovery mode, focusing in particular on youth who face barriers to employment. We are also augmenting our investment in the Student Work Placement Program, An additional $186 million will help create 20,000 job placements for post-secondary students in their field of study. We have approved 70,000 Canada Summer jobs this year and are announcing the creation of 10,000 more because we know how tough the job market is for young Canadians. This new investment of $61.7 million will get more employers through the door, bringing the total of CSJ jobs to 80,000 jobs until February of 2021. We know from previous economic downturns that students and youth are the last to recover, and in order to avoid consequences down the road, we are choosing to invest in them now. Au fur et à mesure que nous travaillons à rouvrir l'économie, nous continuerons de fournir aux jeunes le soutien et les opportunités dont ils ont besoin, puisque quand nos jeunes travaillent et réussissent, ce sont nos communautés et le pays tout entier qui en tirent profit. Thank you. Merci.
Thank you, Minister Qualtrough. Minister Qualtrough, just so you know, the microphone's a little bit close to your mouth, so it's causing a popping for the interpretation. So just for when the questions and answers commence, if you can just move it away, that'd be great. Thank you so much. Hello, everyone. As Canada's Minister of Diversity and Inclusion in Youth, my name is Bartis Chager, and I acknowledge that COVID-19 has impacted every segment of our society, and Canada's youth are no exception. Post-secondary students and recent graduates are facing unique and unprecedented challenges. The pandemic has impacted their studies, their ability to secure and retain jobs, pay bills, and to save for school in the fall. En même temps, nous savons que près de la moitié des organismes sans but non lucratif ont du mal à trouver des bénévoles alors que leurs besoins en matière de services ont augmenté et qu'ils ont la difficulté à fournir des services et leur communauté. Nous avons donc créé la Bourse canadienne pour le bénévolat étudiant. Today, I'm happy to announce this grant will provide between $1,000 and $5,000 to post-secondary students and recent graduates who participate in eligible volunteer service opportunities from today until October 31st. The greater the number of hours volunteered, the greater the grant amount, up to a maximum of $5,000. Post-secondary students, recent graduates, and not-for-profits will come together on the I Want to Help portal. Pour être admissible à la bourse, les étudiants doivent être de récents diplômes ou inscrits à un programme d'études postsecondaires menant un baccalauréat ou à un diplôme ou un certificat. Les élèves sont passionnés, engagés et prêts à faire une différence. Et nous savons qu'ils veulent aider à faire une différence positive dans leur communauté. Opportunities range from being an online tutor with pathways to education, being a mentor with Grand Frère, Grand Sœur, also known as Big Brothers and Sisters, or helping kids learn to code with Kids Code Jeunesse. These are just a fraction of the over 20,000 opportunities available on the I Want to Help platform as of today. As the Prime Minister has said, youth are not only the leaders of tomorrow, they are the leaders of today. More than ever, Canadians need their bold ideas, innovative solutions, and their caring hearts. I encourage all students and recent graduates to visit the I Want to Help platform at canada.ca/I Want to Help ou canada.ca/je veux aider to find opportunities today. Thank you, merci, and we will now take questions.
Thank you, Minister. So as usual, we're going to start with the phone with 3 questions. 1 question, 1 follow-up, and then we'll turn to the room. Operator, over to you.
Thank you. Merci. Our first question, notre première question nous vient de Émilie Bergeron avec Agence QMI. Please go ahead. À vous la parole.
Oui, bonjour. Ma question est pour Dr. New et peut-être aussi la ministre Hajdu, si vous avez quelque chose à ajouter. Le gouvernement du Québec a décidé qu'il ne publierait pas des données sur la COVID-19 qui ne tiendraient pas ses mises à jour quotidiennes, comme c'est le cas maintenant, qu'il ferait des mises à jour hebdomadaires, donc une fois par semaine. Par contre, il y a quand même beaucoup de cas encore et c'est là qu'on retrouve l'épicentre de la crise encore. Est-ce que vous avez des inquiétudes par rapport à ça?
Merci pour la question. C'est Dr. New. Moi, je pense que le principe le plus important, c'est vraiment de continuer à ramasser les données probantes et aussi assurer qu'on n'oublie pas de collectionner, d'avoir tous les cas dans une base de données. Et aussi, c'est très important, d'après moi aussi, de partager les informations aussi avec nous autres à l'échelle fédérale pour avoir, comme on dit, un aperçu vraiment c'est qu'est-ce qui se passe à travers le pays. Pour la province de Québec, c'est vraiment une décision pour les autorités de santé publique. C'est quoi la meilleure façon de disséminer l'information? C'est sûr, au sein du ministère, que l'information, les données, je pense que sont bien partagées, mais pour la population générale, je laisse vraiment aller les autorités de santé publique de la province pour déterminer c'est quoi la meilleure façon de disséminer l'information aussi à la population générale.
Minister Hajdu?
Minister Hajdu?
Je suis d'accord avec Dr. New.
I agree with Dr. New.
Émilie, en suivi?
Émilie, follow-up question, please.
Oui, y a-t-il pas un risque que étant donné qu'on n'aura pas de mise à jour au quotidien, n'y a-t-il pas un risque que les Québécois fassent moins attention à la COVID-19 et qu'il y ait donc plus de propagation?
OK, oui, merci. Comme suivi, merci pour la question. Je pense que les choses importantes, c'est toujours de continuer avec, comme dit, la sensibilisation, l'éducation de la population générale avec toutes les bonnes pratiques, les bonnes mesures de santé publique. C'est toujours les mêmes choses. On souligne toujours de garder la distanciation physique, les bonnes hygiènes pour se laver les mains, utiliser peut-être un masque, un couvre-visage si ce n'est pas possible de garder une distance et de mettre en public. Toutes les choses comme ça, il faut souligner. Ça, c'est important. Je pense que, je ne sais pas exactement, mais je pense qu'on continue. Moi, j'ai bien écouté même la publicité à la radio du gouvernement de Québec pour toujours comme sensibiliser la population. Ça, c'est la première chose. Pour les données et qu'est-ce qui se passe actuellement avec l'épidémiologie, moi, je ne peux pas commenter exactement, mais je suis sûr que s'il y a une situation, vraiment quelque chose, une éclosion, quelque chose d'important, je pense que je suis presque sûr que les autorités de santé publique au Québec vont prendre l'occasion pour peut-être avoir un point de presse spécifiquement ou peut-être même publier les données si vraiment il y a quelque chose un peu inquiétant, peut-être une autre éclosion, par exemple, à Montréal. Je pense que le rythme de peut-être disséminer les données hebdomadaires, c'est comme régulièrement, s'il n'y a pas grand changement, mais s'il y a quelque chose de spécial, un peu préoccupant et inquiétant, je suis sûr que les autorités de santé publique de Québec vont mettre ça au public.
Will make all this information public.
The question was about, are we worried about, whether Quebec, is only giving information once a week? I think the most important thing, first of all, is that all of the good public health measures, continuing to underline, to emphasize, to educate, to say in French, sensitize the population to what they should be continuing to practice, which is a social distancing of 2 meters, a good hand hygiene. Obviously, I didn't say in French, but staying home when you're sick, wearing maybe a face covering or mask in public when you're unable to maintain that 2-meter distance. Those are all important things to continue to do. And certainly I've seen or I've heard myself, radio spots in which they continue to tell the public that these are important measures to continue to do. With respect to the data, certainly my understanding is that it's all right to give the data on a regular basis, maybe once weekly, but certainly if there was a hotspot or something unusual, an outbreak, for example, maybe in Montreal or some other spot, I'm sure that the officials in Quebec would certainly be transparent and have maybe a special press conference or disseminate the information in the public space if there was an unusual situation.
Thank you, Dr. New. Operator, next question, please.
Thank you. Merci. Our next question, notre prochaine question nous vient de Lauren Gardner with Politico. Please go ahead. À vous la parole. Ms. Gardner, please unmute your line.
So we're just going to take the next question, operator, please.
Thank you. Merci. Our next question, notre prochaine question is from Micheline Laflamme with Radio-Canada. Please go ahead. À vous la parole.
Bonjour. Ce matin, on a posé la question au premier ministre Trudeau concernant le haut taux de décès dans les centres de soins de longue durée au pays. On a un très bon bulletin à cet effet-là. Et il disait que ça prendrait des normes nationales. Alors, quels sont les éléments, à vos yeux, qui devraient justement faire partie de ces normes? Comment faire pour qu'on ait un meilleur bilan dans les centres de soins de longue durée s'il y a d'autres éclosions?
Merci, c'est Dr. News. Peut-être, je commence peut-être, ministre Hajdu, c'est quelque chose à ajouter. Je pense qu'en fin de compte, les choses importantes, c'est vraiment garder les principes de santé publique et aussi pour la prévention et le contrôle des infections. Je pense, j'ai constaté avant que qu'est-ce qui se passe actuellement ou même au passé avec nos établissements de soins de longue durée à travers le pays. C'est une tragédie nationale et il faut faire mieux pour protéger la santé et la sécurité de nos aînés à travers le pays. On a vu que dans toutes les provinces et territoires, on a maintenant implanté, on a tout utilisé les lignes directrices pour protéger les résidents, aussi le personnel, les mesures comme, par exemple, même les travailleurs, peut-être ils doivent seulement travailler dans un établissement au lieu de peut-être plusieurs établissements de soins de longue durée. Ça, c'est une mesure qu'on peut implanter. Aussi, le dépistage de tout le personnel et même les visiteurs qui veulent rentrer aux établissements. Aussi, l'utilisation de désinfectants pour les mains en rentrant. Toutes sortes des autres mesures comme la séparation des résidents malades avec des autres qui ne sont pas malades. Toutes ça, les mesures vraiment pour la prévention et le contrôle, je pense, font partie d'une base pour les normes. Je pense que avec les principes, c'est sûr que chaque province et territoire peut-être vont élaborer peut-être leurs propres normes ou lignes directrices, mais je pense que comme une base à l'échelle nationale, les bons principes de santé publique et pour la prévention et le contrôle des infections seront à la base. Merci.
Selon la Fédération canadienne des syndicats d'infirmières, le taux d'infection chez les travailleurs de la santé au Canada est de 19 %. Alors, il y a des travailleurs qui dénoncent justement le manque de protection. Alors, les mesures mises en place pour assurer la protection et la sécurité des travailleurs sont-elles suffisantes au Canada? Et qu'est-ce qu'on pourrait faire pour améliorer tout ça?
Merci pour la question. C'est sûrement une priorité dans toutes les provinces et territoires. Dr. Tam, on discute toujours avec nos homologues des provinces et territoires parce que c'est vraiment une priorité de protéger la santé et la sécurité des travailleurs des soins de santé. C'est sûr que la science continue à évoluer et avec toutes sortes de mesures, même aussi l'utilisation de la protection, l'équipement de protection individuelle, on continue à analyser bien les données probantes. Avec l'évidence que vous avez déjà constaté que 19 % peut-être des travailleurs sont infectés, c'est très important de faire une analyse plus, en profondeur pour regarder c'est quoi peut-être les facteurs. Des fois, c'est qu'est-ce qui se passe dans les lieux de travail. Mais des fois, c'est aussi possible que les travailleurs de soins de santé sont aussi comme les autres individus dans la population générale. C'est peut-être aussi des risques. Ils se sont exposés peut-être à l'extérieur des lieux de travail, peut-être même au domicile ou peut-être dans la communauté. Donc, c'est très important de vraiment faire des analyses pour voir c'est quoi les circonstances. Est-ce que c'est en faisant quelques procédures médicaux ou est-ce que c'est dans quelques circonstances avec les patients très malades? C'est toutes sortes de facteurs qu'on continue à analyser. Et c'est ça, avec l'évidence qui continue à accumuler, on peut peut-être élaborer les lignes directrices et aussi des autres mesures pour mieux protéger. C'est toujours ça, on peut toujours faire mieux et on continue à faire notre mieux pour protéger les travailleurs. Merci.
Merci, Dr. Nou. Opérateur, prochaine question, s'il vous plaît.
Next question, operator, please.
Thank you. Merci. Our next question, notre prochaine question nous vient de Theresa Wright with the Canadian Press. Please go ahead. À vous la parole.
Yes, thank you. My question is for Minister Hajdu. Just following up on the questions about Quebec's health department saying it's no longer going to issue daily releases on COVID-19 data. What message do you think that this is going to send to the public? And do you have concerns that Quebecers will begin to take the virus less seriously as a result?
Well, thank you very much for the question. First of all, I think the important piece is, as Dr. New pointed out, that the data has to be shared on an ongoing basis and a regular and actually rapid basis with the federal government, because, of course, that allows us to support provinces and territories in a timely way and to get a better idea of what's happening across the provinces and territories. As you know, we play, I think, an important role in supporting the work that they're doing to manage any potential hotspots and to manage any potential outbreaks. And so that will be of critical importance. But as Dr. New mentioned, I suppose it depends on how the province determines how they will communicate with Quebecers. And as he's pointed out, there is an ongoing messaging from the province of Quebec, as there is from the federal government nationally, about the need to continue with the public health measures that are keeping us all safe. It is really important for Canadians to not think this is over in any sense of the word. And so it's I think that's of primary importance, that the communication outward continues to be that this, although we are sort of out of the, as Dr. New and Dr. Tam said, the sort of surge that we saw in March, and now we are putting out localized fires, that we still have a really important role to play, all of us, no matter where we live, in making sure that none of those fires reignite. And I think Quebecers have been through a really difficult time, just like all Canadians, and I think they will be very open to hearing how they can continue to protect themselves and their loved ones.
Theresa, follow up?
Yes, thank you. Also, last week you promised an update on the work of the Immunity Task Force. Can you provide that update today? And if not, why not? And when can individual Canadians get an immunity test?
I will turn to Dr. Tam to talk about the work of the Immunity Task Force. There is a lot going on, and I know that she's involved directly with the task force.
Yes, I think the task force also puts out communication as well. So, I think that's important. I know that Health Canada has now authorized more serologic tests, so that's good news. And the National Microbiology Lab's also involved in looking at the performance, if you like, of some of these tests. So that's really important before we launch into immunity testing. And we're not, the Immunity Task Force isn't the only entity doing the testing as well. So what we do know is that the government of Canada has finalized a contract, for example, with Abbott Laboratories for 140,000 serologic test kits. So acquisition of the test kits are important, and we'll be acquiring others and making sure that they perform. And then also, I think as we said last week, the partnership with Canadian Blood Services and Héma-Québec is there to keep recruiting and collecting samples so that we can actually get through the testing of those pretty rapidly for the initial survey. So that is the agreement with the Canadian Blood Service and Héma-Québec, is that will be the initial survey. And one thing that I felt was probably quite important to point out is engagement with different population groups as well, because we need to assess immunity in different populations in Canada, and some of it involves, I think, meaningful engagement with different populations. I know that one engagement is with the Indigenous Advisory Circle, with representatives from Indigenous communities across Canada. So it's important to not just do the testing with the robust science, but also to do it right, and so that people are appropriately engaged. So I think a lot of this work is ongoing at the moment, but I think, as Minister Hajdu said, we will inform everyone as soon as the initial testing gets started. But we're acquiring all the necessary resources to begin.
Thank you, Dr. Tam. So we're now going to turn to the room, starting with Kelsey from Reuters.
Thank you very much. My question is for Dr. Tam. Yesterday, Ontario announced that it was going to allow some workers who had tested positive for COVID-19 but were not showing symptoms to continue to go to work, provided some protocols were in place. I'm wondering what your reaction to this policy is, and does it not send mixed messages to Canadians who have tested positive for COVID-19 and have been told for the last 3 months, please stay home?
Yeah, so I think I'll certainly be connecting with my Ontario colleagues who understand exactly what that protocol is. I don't really know the details, but it sounds like some type of cohorting or grouping of people who are test positive and asymptomatic to allow them to work. I think the key is that there are two aspects to why it's important to keep people who are testing positive isolated. So that's the fundamental public health objective, so that, one, they don't spread the virus to others. So whatever protocol is being envisaged, that's got to be really important. It has to be stringent enough so that you're not spreading the virus to others, because asymptomatic people can spread the virus. So I don't know what the details are to that, but that would be extremely important. The other aspect I think I would be, thinking very carefully, and people should pay attention to, is that people can begin to have symptoms anytime, during that incubation period, and potentially can get sick, fairly fast. So for the sake of the health of the workers, if they're going to be working really hard, is that you need to make sure that you screen them for symptoms and enable them to stop working if they're not feeling well, because I think the health of the workers are extremely important, not just to protect the community. And sometimes people don't realize they're getting sick. So I think that would be really important to look at. But as I say, it's something that sounds kind of new, and it needs to be looked at carefully and evaluated as well.
So appreciating that you haven't been able to see all the details of this program, one of the environments where it's being proposed would be on a farm. And I'm wondering, given the outbreaks that we have been seeing amongst farm workers, and Minister Qualtrough, if you would like to chime in on this as well, given you oversee the program, I'm wondering if there's a concern that we could see an uptick in outbreaks amongst vulnerable populations like migrant farm workers who are already working very hard every day.
Well, I think we are already seeing these outbreaks. So we do know that this is a group and a setting, perhaps depending on maybe where they live, whether they're congregate living settings. I think multiple departments, federally and at each level of government, certainly working with the farming sector, and Minister Qualtrough can comment on that, is that we have to ensure that all the conditions are right to support the workers, so that they can, if they're sick, don't go to work and be supported through that period. They're isolated with full support for the daily needs of the workers, to have the ability to communicate and have translation if necessary, if they should get sick, have testing offered freely and immediately if there's a case in any farm setting. So, and of course, rapid contact tracing and quarantine. So those are really important. So what is happening is that the Public Health Agency has actually mobilized an infection prevention and control expert on the ground right now just to connect with the various players, because it's a very complex setup, just to understand what's going on and see if we couldn't offer some technical expertise on how to do infection prevention and control in the best possible way while supporting the needs of the workers, because this is for sure a vulnerable population. So I'll let Minister Qualtrough maybe supplement that.
Well, thank you. I would certainly defer to public health officials to examine the contents of any protocol that's being developed. But my number one message remains for Canadians and particularly vulnerable workers that if you are sick, you have every right to stay home. And from a public health perspective and infection control perspective, we want our workers, and we're asking our workers to continue to stay home, and that's why we've extended the CERB, to which temporary foreign workers have access. We are, as Dr. Tam said, investing in more rigorous worksite assessments and infection control and also inspections, but also on worker outreach. So workers know their rights, working with local organizations that represent workers, understanding that if you're not well and if you are sick, you have every right to stay home, and that you don't have to work. And in fact, we don't want you to work. So we're obviously looking into this. But my number one message from a labor force and workforce perspective is workers don't have to work if they're sick. And we're telling workers across sectors and across employers not to work if they have signs, or even if they've tested positive for COVID. Until you're no longer positive, you're still you can still pass on and transmit the virus. So I'm babbling a bit, but I want to emphasize that we need to make sure workers understand their options.
Thank you, Minister. Annie?
Hi, it's Annie Bertrand-Oliver with CTV National News. My question is for Minister Chagger. Today you announced the creation of 10,000 new job placements for young people between the ages of 15 and 30 through the Canada Summer Jobs Program, which provides wage subsidies to companies so these young people can work. Your government is already struggling to get businesses to use the wage subsidies. So what guarantees do you have that these 80,000 jobs you're pitching students will actually be created for summer students?
Annie, you had me so excited. I thought we were going to talk about the Canada Student Service Grant. I'm going to go to Minister Qualtrough first, and then I will.
So, Annie, we made changes to the Canada Summer Jobs program this year where we introduced more flexibilities so that as many employers as possible could avail themselves. What happened was the program was actually oversubscribed. So we originally had 70,000 jobs we were planning to support this summer, and it was oversubscribed. So now we're adding an additional 10,000 jobs to the mix so that communities across the country can take advantage of this program at 100% subsidized position and really have young people working in communities across Canada.
So just a point of clarification, if it was oversubscribed, does that mean you've already had about 70,000 summer students placed into positions?
Yeah, so we've actually posted 70,000 jobs. So we've had employers post the jobs. All of them haven't been filled. The last batch was just posted last Friday. But we have the 80,000 refers to the number of jobs that are going to be available. We have young people every single day signing up through Job Bank for this job. And we have student organizations and youth organizations across the country telling us that these jobs will be filled. I have every confidence they'll be filled.
Now I will be asking about the Canada Summer Grants Program. So when the government announced the Canada Student Summer Grants Program about 2 months ago, it said that the funding would go towards helping students with the cost of post-secondary education. I'm just wondering what strings are attached on how students can use this money. Is it only for tuition, or can they use the grants that they will be receiving from the federal government to help offset the cost of things like rent and utilities? And when will the first checks be delivered to students?
Excellent question. Thank you so much. This actually builds upon the suite of programs that we've offered to youth and students, which includes building upon the Canada Summer Jobs. Those are opportunities for small businesses, not-for-profit organizations, charities within communities to be able to provide employment opportunities. What we've also been hearing is that there are lots of not-for-profits that have service opportunities and can benefit from the skills that young people have to contribute. So this is an opportunity for not-for-profits to partner with young people in their communities to help heal communities. And how it will work is that postings can be, not-for-profits can continue to go to the I Want to Help portal and post their positions. Students will be able to accumulate their hours, submit their hours at one point towards the end of October 31st, and then receive a grant between the amount of $1,000 and $5,000. That grant can be used for any expenses related to post-secondary in the fall session. We recognize that the strain on students is huge, and it is diverse depending on the individual and the region and so forth. So yes, this grant can help them in any of the expenses that they have, recognizing and acknowledging that they too have expenses.
Merci, Madame la Ministre. Gentleman from the Health Times.
Aiden Shmandi, Health Times. So I think this is probably best for Minister Hajdu. It's on the contact tracing app. So this is a federally endorsed app that's being rolled out provincially, and the interaction is between an individual and a provincial public health authority. So I'm wondering if you could clear up the kind of jurisdictional lines for me a bit, just which level of privacy commissioner will have domain over what parts of the app.
Well, thank you very much. Given, I'll have to get back to you with the specific answers of which part of the app are governed by which privacy commissioner, but I can tell you that throughout the design of the app and throughout the focus of introducing an app, our focus at the federal level was privacy first and foremost. And in fact, the Prime Minister stressed that in multiple occasions as we were working through the various options that we might have. So that's why we've chosen the approach that we've chosen, because we know that privacy is of utmost importance to Canadians, and this actually does not in any way infringe upon their privacy. And obviously, our privacy commissioner is actively engaged in the work at the federal level.
So can we expect a privacy impact assessment before the app's rolled out in Ontario?
That I can't answer. I don't know the answer to that. I will get back to you.
News. Minister Hajdu, I think this is for you. The PM said a couple of times in his news or earlier today that the provinces have failed our seniors, Canadian seniors in long-term care homes. Do you think the federal government bears any responsibility for the situation there?
Look, I think any death is a tragedy, and we all reflect, no matter what level that we govern at or lead at, how we could have better worked to protect lives that were lost and how we could better protect citizens. So, I think it's important to reflect that we all have roles. But I think what the Prime Minister is referring to is that historically and practically, the federal government does not have any levers in long-term care homes across the country. It is not part of the public health care system as in terms of how jurisdictions are divided and our roles and responsibilities. But I think we've been very clear that we also, throughout this pandemic, realized that there was a very strong intersection for federal government to support the provinces and territories as COVID-19 began to really impact long-term care homes, in particular in Ontario and Quebec. And certainly you've seen us step up to the plate in terms of providing additional support with human resources through the military and mobilizing the Red Cross and funding the work of the Red Cross, ensuring that we could support and augment the access of personal protective equipment for provinces and territories so they could better disseminate it to the variety of different long-term care home settings that they have in their jurisdiction. So I think the Prime Minister's comments reflect the fact that we have not typically had any role or responsibility or any opportunity, if you will, to influence how long-term care is delivered in the country. And having said that, I think he's also been very clear that now is the time that we work together collaboratively with the provinces and territories to improve how long-term care is provided across the country so that Canadians, no matter which jurisdiction they live in, have assurances that their long-term care facilities are treating our elders with the dignity and safety that they deserve.
Next question, I'm not sure if it's for Minister Chagger or Minister Qualtrough, but the charity We, is going to be administering at least part of the news volunteer grant. Sophie Gregoire Trudeau is pretty intimately sort of associated with We. I'm just curious how that's not a conflict of interest.
Thank you for the question. So We Charities is an organization that works with 2.4 million young people across the country, 7,000 schools, and so has quite the reach. And when it comes to the success of the Canada Student Service Grant, it's important that we be able to work with an organization that can ensure that they have the ability to deliver a successful program. And so today, with the website being launched, we want to ensure that all factors were considered in its success, because we want young people to be successful, especially during this unprecedented and challenging time. So there's over 20,000 postings that have been posted. We Charities is able to work with not-for-profits and provide the technical support that's required for this program to be delivered. And I would just say that when it comes to Employment and Social Development Canada, they assessed We Charity as having the necessary experience, expertise, and capacity to deliver the large-scale program, which will provide post-secondary students and recent graduates with service placement opportunities this summer while delivering much-needed support to Canadian not-for-profits.
About a perceived conflict of interest with Ms. Gregoire-Trudeau?
I would have confidence that the department has done all the checks and balances to ensure that everything will be successful and work for the young people that we are here to represent.
Thank you, Minister. Ceci met fin à la conférence de presse pour aujourd'hui. That's it for today. Thanks, everyone.